Welcome to the Possibility Action Network podcast. I'm your host, Stephen Middleton, aka Possibility Man. We're committed to bringing you guests who strive to better people's lives and serve as a force for good in the world. Our guest today is Danielle Mitchell. She's the founder and CEO of Black Women in Clinical Research. Danielle is passionate about supporting Black women and is on a mission to create a more inclusive and equitable environment for those seeking careers in the clinical research industry. Danielle, welcome to the show today.
Thank you so much. Thank you for having me.
Aha. Look, I'm looking forward to this conversation. But first, a reminder to our listeners and our viewers, follow, like, and share this podcast wherever you find it. Your support matters and is appreciated. Hey, Danielle, I'm not sure if you remember or not, but I discovered you. I discovered my talents. I discovered you on the LinkedIn platform. And when I saw that you were engaged in clinical research, it was a no-brainer. I said, I got to talk with her. Do you recall that? I reached out to you soon after that.
Yes, I do. I do recall you reaching out to me on LinkedIn. And I tell everyone that LinkedIn is a gold mine. There's so many opportunities and so many ways that you can network with people on LinkedIn.
Yeah, and you're doing a great job of that. I'll come back to that before we close, should we have time. I've introduced you briefly, but I want people to know a little bit more about your background. Can you give us a glimpse into your path up until this point,
Absolutely.
educationally?
Educationally. So absolutely. I always like to start with a little background of where I'm from. So I am
Okay.
from Detroit, Michigan, and I attended, they like to say, the Clark Atlanta University. And I wanted to go to medical school. And so when I decided not to go to medical school, there were not a lot of options for someone with a bachelor's degree in biology. So at the time, some of the options, some of the career options was working in the lab or becoming a teacher. So I worked in the lab for years, but I knew that I wanted to make a greater impact. And I actually found out about clinical research at a pool party. And so in my undergrad, we never talked about research in humans. We talked about research in animals. And I was just amazed when I ran into my college classmate who told me about clinical research. She said she was a CRA. She said she gets to work from home. She gets to travel. So I said, sign me up, because at that time I was working in the lab and only making $35,000 a year. So I just knew that I wanted to embark on this journey. And I realized very early on that there were challenges with getting into the clinical research industry.
Uh-huh.
So I guess I can stop there because I could go on and on.
Yeah. Well, that's good to know. I'm glad you said that. So now, but you mentioned having an interest in medical school early on. So you must have been one of these precocious young people thinking about medicine. At what point were you thinking about medicine and biology and the sciences? Do you recall when that bug hit you?
Yes, so I was in the medical academy in high school. And so I had decided that I wanted to go to medical school, and I had a love for science as well. So I really feel like the turning point for me when I wanted to become a doctor was when I helped deliver my baby sister at 15
Mm.
years old. So I was all involved in my mom's delivery. And so because my family members knew that I wanted to be an OBGYN, whenever they were having a baby, they would call me so that I could be in the room with them. So I really got a lot of exposure very early on when it comes to obstetrics and gynecology, and to see if that was something that I was interested in. I still love babies, but I just kind of I did a different path, I would say.
Yeah. It sounds like you found your calling. Now, that the conversation at a pool party must have been something to turn you, on a dime to pursue what you're doing now. Do you recall the level of that conversation? What grabbed you? Was it just clinical research, or was there something more that grabbed you?
So my grandmother had breast cancer.
Uh,
So I've always been interested in anything under the biology umbrella. I tried clinical genetics, I tried microbiology. So hearing about clinical research and hearing that, you have a chance to help people And it's like the perfect merge between science and research. So knowing that I could help someone like my grandmother who had breast cancer and really focus on women's health because that's my passion, and also a job that offers flexibility. And, at that point in my career, I was working in the lab, so there was no windows. I worked in the dungeon. I called it the dungeon because it was in the basement. So to have that opportunity to, in a sense, come upstairs for fresh air and actually, be able to communicate and help people in a different capacity, I was so interested. I said, why I should give it a try. Why not? What else do I have to
Yeah.
lose?
Uh-huh. That sounds good to me. Hey, look, so what's the function of clinical research? People may hear the phrase clinical research, and some people may not know what that's about. What is that?
So when I think about clinical research, and I like to put it in simple terms, I
Mhm.
think about that this is making sure that drugs are safe and effective for everyone, and especially my focus is for people of color. And so historically, Black people do not participate in clinical trials because of what has happened in the past. So we are making sure that the drugs are being tested on people who look like the community, and especially for drugs that are, for example, in Michigan, it might be breast cancer. So diseases that really affect the community. And if we do not make sure that the drugs are tested on people who look like us, then it means that the drugs are not safe and effective for people in our community.
Yeah, that's an important point. I'm going to stay with this for just a little longer because I'll tell you, many years ago, maybe not that long ago, I did not have the understanding, the awareness that there are different genetic markers for different people. The same thing that worked for women may not work for men or men for women. So, what you're saying is that the pool of subjects need to include a diverse group of individuals and not just individuals from one group. Is that about what you're telling us?
Yeah, because most people who participate in clinical trials are white males.
Yeah.
So if all of the drugs are based upon a white male that's in his 60s, then how is this drug going to help you? So we
Yeah.
have to look at the bigger picture and look at how this, having this drug tested on you is an opportunity for you to be closely monitored. A lot of people don't realize that when it comes to clinical trials, that you're going to be closely monitored. The study staff, they're going to monitor all of your data, and you're going to have a very close relationship with them versus this drug is out on the market and you've been prescribed this drug and you're just going to take this drug and no one's monitoring you. And
Mm.
so I always tell people to think about that, and for this also to be a chance of you finding out more about your health. So there are some tests that may occur depending on the clinical trial where you can find out more about your health versus, just not having these options available to you.
Yeah, I mean that's important. As I said, I wasn't aware of this many years ago. Not maybe not that many, but clearly people are different. There's some 7 footers, some 4 feet eight, that kind of thing, and their body chemistry work differently. So I see that. So do people volunteer for clinical trials, or how does a person become involved in a
So
clinical
you
trial?
So you can volunteer for clinical trials. And so what a lot of people don't know is that at any point you decide that you do not want to participate in the clinical trial, you can stop. You can tell the staff, I no longer would like to participate in the clinical trial. But yes, this is a volunteer basis. This is not
Mhm.
something where you're forced to do it, but it's needed in order to really help with science and making sure that medicine is actually helping people that have the disease or illness.
Hmm. And when you looked at this landscape early on, when you looked at people who are clinical researchers and people who are participants, you saw that there was a lack of diversity. I believe I saw that somewhere on your website.
Yes. So once I became a clinical research professional,
Mhm.
I went to an investigator meeting, which is a kickoff for a new study. And so a lot of times they will invite people who are going to be conducting the clinical trials to learn more about the study. So I went to this investigator meeting. I felt like I was VIP. They had a car waiting for me at the airport when I arrived. They had when I arrived, they had my name on a dry erase board. So they really
Uh-huh.
rolled out the red carpet for me when I attended this investigator meeting.
Mhm.
And when I stepped foot in the room, there were hundreds of people in the room, but there were only two Black women, including myself. And so this
Uh-huh.
was back in 2019. And so that's when I started to question, is there a lack of diversity in this room, or is there a lack of diversity in this industry? And
Mhm.
after attending this meeting, I decided to create a Facebook group called Black Women in Clinical Research to see if there were other Black women like myself that may have gone through challenges with getting into the clinical research industry. I just really wanted to create a safe space for Black women to feel comfortable in being a clinical researcher.
Yeah, that's great. I'm glad you're doing this. So, would you say that there are hurdles, there are obstacles for Black women to get into clinical research? Are there hurdles, obstacles?
Yes, there are a lot of hurdles. This industry has it to where a lot of times you have to have 2 years of experience to get in.
Mhm.
So if I have to have 2 years of experience and no one's willing to hire me, how do I ever gain that experience? And so that was some of the challenges that I received. And every clinical research position that I applied for, I was rejected. So
Mhm.
I really had to start from the ground up. I went on clinicaltrials.gov. I found all of the clinical trial sites that were near me, and I began to cold call them and ask them, can I shadow? Can I do an internship? I wasn't going to take no for an answer because like I was telling you before, I went through all of the different careers under the biology umbrella. So I was determined to get in. And that
Mhm.
gave me the foundation that I needed in order to get started in the clinical research industry. It was an unpaid internship. One of the sites that I called ended up telling me, yes, if you're interested in clinical research, you can come in. But my first opportunity in the industry was unpaid. So I had to do Uber Eats, DoorDash, Amazon Flex,
Mhm.
Postmates, you name it. I did it just to gain that clinical research experience.
Uh-huh. You knew what you wanted and you went after it. Look, I'm impressed by that. So, at what point then did you establish the organization Black Women in Clinical Research?
So that was after attending that investigator meeting in
Mhm.
2019. And so actually today is our 5 year anniversary. So 5 years ago, I went on Facebook and decided to create a Facebook group called Black Women in Clinical Research. And it has just taken off since then. Right now in our Facebook group, we have over 11,000 Black women that are interested or in the clinical research industry. So it really just came from my own challenges with being a Black woman in this clinical research industry and wanting to just connect with other Black women like myself. So we have started a movement. There have been other companies that have, I would say probably they consider us as a role model for starting their own organizations as well. So
Uh-huh.
we have really helped shape and mold the industry by being a trailblazer.
That's fantastic. And that's over 10,000 just on Facebook. Look, I checked out LinkedIn, Danielle. You're over, I think, 20,000 and growing. Wow.
Yes. Yes. So, we're always trying to
Uh-huh.
increase our reach. We're always
Mm.
trying to bring more Black women, Black men, and minorities in the clinical research industry. We've helped over 1,000 um, Black women receive jobs in the industry. We have an app now as well that's more organized than the Facebook group. So we just really want to give people the tools and resources needed in order to be successful in the clinical research industry because it can be scary when you
Oh.
are working in these roles, and a lot of times you realize you're the only Black person on your team.
Aha. Look, I'm going to get deeper into your organization in a moment. But first, I want to ask you, why is this important to you? Where is this passion coming from?
So, I always like to, dig deep. And my why is my grandmother and
Mm.
family members that I know that have had illnesses or diseases. So, seeing my grandmother go through breast cancer and
Mhm.
not knowing about clinical research, I feel like maybe if I would have known about clinical research, maybe that could have been an option for my grandmother and maybe that could have prolonged her life. So, I'm very passionate about women's health and, seeing my grandmother go through what she went through, I just want to make sure that we are opening the doors for other Black women, especially
Mhm.
when it comes to women's health. So that is my passion, and I love helping people.
Yeah, that's fantastic for sure. Hey, look, so what type of background would you suggest? Let's say that there's a high school kid, a senior considering college, but she already knows that she wants to do clinical research after college or after a doctorate. What kind of major, what kind of education training would you suggest that she pursue?
So, this is the thing with clinical research. The beauty of clinical research is that you do not need a specific background in order to get into the clinical research industry. My sister, she works, I brought her into the clinical research industry, and she doesn't have a degree. So, it's really about being strategic and networking and letting people know what your interests are. So, like I was saying, if you're interested in an internship, going on
Mhm.
clinicaltrials.gov, connecting with other clinical research professionals, because there are a lot of different programs out there that you can get involved in. And my husband, for example, as well, he's in clinical research and he has a sales background. I know people that are in the industry that have a psychology background, a business background, finance. When you think about clinical research, it's just like any other company. We have HR, you know, contracts and budgets. So it's really a position for everyone. I tell people this all the time.
Mhm.
If you're interested, it's really just about positioning yourself and letting people know what
Mhm.
your interests are.
That's fantastic. I didn't know that it was that wide open. As a initiative, I thought, natural sciences. See, I learned something. As someone once told me, my schema grew. And I'm sure people listening or watching will feel the same way. So, in terms of the organization, Black Women in Clinical Research, were there any obstacles? Well, I'm sure there were challenges in getting this thing started and getting it going.
Absolutely. So I started Black Women in Clinical Research on a salary of 38,000 a year. So I had to do things, I would say, in I don't know if I should say sections, but I had to start with my logo. And,
Mhm.
like I did all of this on my own. I didn't have any outside funding to start Black Women in Clinical Research. This started as a passion and it turned into a company. So I would say challenges for me was starting a company that really you had no intentions of starting. This opportunity and being able to give back fell into my lap. So I would say a
Mhm.
lot of challenges that I do have, especially when it comes to getting companies to, I would say, buy into Black women in clinical research and what we're doing. So, getting sponsorships and getting companies to really collaborate with us has
Mhm.
been a challenge as well. But I am proud to say that since we've been doing this for 5 years now, that we do have a lot of sponsors that are interested, but I know that we can do more and we can help more people. So
Yeah.
some of those challenges a lot of times is getting people to, think about how can they help a small business.
Mhm. Yeah. And when you think of opportunities, what do you envision? What do you see as possible for Black women in clinical research as an organization?
So I want Black women in clinical research to be, and right now, currently we are, but I want Black women in clinical research to be the largest organization for companies that are looking for diverse talent and
Mhm.
having that relationship with a lot of the companies because there are a lot of companies that say that they have a lack of diversity when it comes to the clinical research industry. Well, I have over, 15,000 people that are connected to Black women in clinical research. So this could easily be a conversation or a collaboration where we can talk about how Black women in clinical research can help with staffing and how
Mhm.
we can talk about how Black women in clinical research can help within the community. So to me, the way that we really can make a change or shift in this industry is by having people who are involved in Black women in clinical research to collaborate with these companies so that we can talk to the community about the importance of clinical research. So I just
Yeah.
really think it's about having strategic partnerships and
Mhm.
really being intentional because when you're intentional, you can really affect change.
Yeah, that's awesome. So when you think about your organization, what would you say is your mission? What is your mission?
Our mission is to educate, empower, support, and help Black women thrive in the clinical research industry. And so we make sure in everything that we do that is, I would say, our center. And we have provided a safe space for Black women to feel comfortable with sharing about what's going on in their clinical research world. Every Wednesday, we have our Wind Down Wednesday as well, so that our members have the opportunity to talk to one another. So we have built a community within a community with by creating Black women in clinical research.
Oh gosh, I'm smiling because there's nothing better than connectiveness with other people, and you're doing that. So high praises from me. So in terms of education, tell me about your mentorship programs.
Yes, so we just relaunched our mentorship program. So we have a software that matches our members with, would say, skilled clinical research professionals. So I like that it does the matching because it will match people. Like right now, we have matches that are 98%, 96%. So these are high matches, and this is helping people with their career. So the mentorship, they're meeting twice a month for 3 months. And if they want to continue their relationship on, they have that opportunity to continue their relationship. But this is giving people an opportunity to meet one-on-one with someone who has that clinical research experience that can give them the guidance that's needed and to help them with their goals. So whether they're looking for a promotion or if they're looking to ask their line manager for additional money, or it's just a really good tool to help you grow in your
Mhm.
career and to have someone that is a cheerleader and an advocate for you.
Yeah, you can't beat it. That's for sure. And in your mission statement, you said empower. I like that. I visited your website, so I want to see how they empower. And I saw career services and some of the things that you do with your membership. I think coaching was one. Is that one way that you empower women in this field?
Absolutely, because what we realize is that a lot of times, people just need someone to motivate them.
Yeah.
And also, I know for myself, I didn't know how to do a clinical research resume. So having
Mm,
someone that has clinical research experience that can help you really make sure that your resume is marketable to these companies. And
mm.
so we have resume professionals, we have career coaching, we have LinkedIn summaries, we have cover letters. So really, we want to make sure that we're helping you to put yourself in the best light. Your
Yeah.
resume is a walking introduction, and this is what a lot of times companies see when you are interested in a role.
Yeah, I mean, look, I'm with you there because as simple as we sometimes think that is, getting help with a resume tailored to an industry is important. So, yeah, that's huge. Yeah. So, any other ways that you try to empower women in clinical research?
Yeah, so we also have apparel. I'm wearing, I don't know if you can see it, but I'm wearing a shirt.
Yeah.
Yes, so that says clinical research her. So there is power when you are wearing, especially the clinical research apparel, and you feel connected to what you're doing. You feel connected
Mhm.
to, how you're changing lives. So having that apparel, and a lot of women feel so empowered when they wear the Black Women in
Mhm.
Clinical Research t-shirts or any other items that we have in our store. But we want people, especially the Black women, to feel empowered when they're in their community. It's a conversation starter as well when you're wearing a clinical research, top or any items that you may have that have the clinical research logo on it, for Black women in clinical research. We're also offering training in our app. We
Mhm.
have so many different topics. So whether you're a mom, we have the BWICR moms. We have different trainings that are available with the companies.
Mhm.
We talk about what to wear when you're working in the clinical research industry. So there's so many different topics, book clubs. I'm just trying to think of everything. We even have the
Wow.
companies listed there in our app. if you want to connect with people that work at that company that are in Black women in clinical research. So we just want to make sure that we are your one-stop shop for all of your clinical research needs, especially when you are working in this industry, so
Yeah.
that we can support you.
That's great. Look, I've just decided on my Christmas gift to my daughter, and it's going to be one of those. For those of you who are listening, Danielle is wearing her swag, her top, and she sat back in her chair, and I saw the imprint on that. Look, I want one of those. We'll talk about those later. Can anyone can get one of those, right?
Oh yeah, absolutely. You can go on the
Uh-huh.
website. We even have something for the Black men in clinical
Uh-huh.
research as well. So
Okay. Okay.
that's another one.
That's great. And we'll talk. I want to talk about their affiliates in a moment, but I also want to put into the record. Look, when this interview comes out, I want something from maybe your logo to put on my social media platforms. And I'm calling on all of you who watch this or hear this to get your logo and put it on your platforms. We're going to participate in this movement to get the word out across the USA and perhaps even internationally. Why not? All of us care about this subject. How about that, Danielle? Are you open to it?
That sounds good. Let's do it.
Okay. Hey, look, I know that you also feature some of your members. I think it's called Spotlight on your website. Tell us about spotlighting members.
So we just want to have the opportunity for people to get to know some of the members. A lot of
Mm,
times with BWICR, you may not be aware of what some of the great things some of the members are doing. So it's just an
mm.
opportunity to highlight the members and the great work that they're doing in the clinical research industry.
That's fantastic. I love it. Everyone likes to see their likeness in print, right? Or on a website. That's boosts their confidence as well as letting people know more about them. Daniel, that's wonderful. Hey, look, so how do you measure, the progress of your organization? What are some of the markers that you look for?
So I look at our how many companies that we've been able to have sponsorships and collaboration with. So how far have we grown? And
Mm,
also I look at how many members are, I would say, actively participating. And so like looking at our growth from year one to year two, how many more members have joined Black women in clinical research. So I'm
mm,
always looking at the metrics, seeing if there's ways that we can improve. Is there something that we can do on LinkedIn? So I'm always looking at how many, I would say, impressions on LinkedIn the post have, just really, I would say, customizing what people are looking for. So right now
mhm,
with our mentorship program has the most likes and impressions. So making sure that we are highlighting the mentorship program and letting people know. So I'm always looking at different, I would say, numbers when it comes to BWICR. How many people are located in this region? And
mm,
so how have we grown? And just really recording those numbers and to be able to look at it on a yearly basis. So when we first
yeah.
started Black Women in Clinical Research in 2019, there were only 20 people or close to 20 people in the Facebook group. And now to look at it in 2024, we have 11,000 people that are in the Facebook group. So really just looking at the numbers and seeing, how we have grown, what we can do to reach more people, whether that's reaching out to the different colleges and universities. So I really look at it by how we are really
Mm,
connecting with the community and also looking at how many lives we have changed with having our career services. So we've helped over 1,000 of our members receive jobs since 2019. And so we want to make sure that we are increasing that number and what we can do
mhm,
to help people. And we have to listen as well when it comes
yeah.
to this. And what do our members want? And what
Yeah.
do they need? And having a conference coming up, I feel like it's the ultimate place for a lot of members to receive those resources and the help that they really need in the industry.
Yeah, yeah, you've mentioned your conferences. We have one coming up, in 2024. So, but you have conferences. Is it annually or what? Tell us about your conferences and what you try to do at some of them.
Yeah, so this will be our second annual conference, November
Mhm.
8th through the 10th in Atlanta, Georgia. And so this year, our theme is breaking barriers and building resilience. And
Mhm.
so we want all of our topics to focus on this. And we also want our members actually to leave with information that they can use and they can take home. So
Yeah.
to me, it's no point in having a conference if you are not able to receive information and being able to use some of those tools to help you
Mhm.
when you go back home. So we want to make sure that our members are inspired. We also want to
Mhm.
make sure that they have an opportunity to receive jobs. Last year in 2023, 15 of our members received job opportunities. So just making sure that people are able to network, find your tribe. A lot of times when you're coming to the conferences, last year we were able to connect people in different roles. So if you was a clinical research coordinator, you were able to connect with other clinical research coordinators. If you were a clinical research associate, you were able to connect with other clinical research associates. So being able to hear our keynote speaker, she's speaking again, Dr. Jane Morgan. She's amazing. Last year, it was so crazy is what she said last year has still stuck with me in 2024. So I am excited to hear about her talk. I'm excited to we have a session on AI in clinical trials because that
Mhm.
is a hot topic. So just making sure that we have the latest information and that these are topics that are relevant to our members.
Mhm. So can anyone, purchase a registration to your conference, or do you have to be a member of the organization?
Anyone can attend. We
Uh-huh.
want everyone to feel comfortable with attending our conference. We just want people to know that the focus is on, Black women, Black men, and minorities in the clinical
Yeah.
research industry, just because there is such a low number when it comes to the clinical research workforce and the clinical trial population. So, like I
Uh-huh.
was mentioning before, being intentional and making sure that we are doing all we can to really help our communities.
Yeah, I can imagine teachers and leaders all over would be interested in that. So, what advice, Danielle, would you give, let's say, a high schooler or even a college student who are wondering about careers in clinical research?
So I always say that a career in clinical research requires research. This is not an easy industry to get into, but
Mm.
when you connect with the right people and when you network, you are able to create an atmosphere that's easier for you to get into the industry. So if you have the resources, if you can go on clinicaltrials.gov or you can find Black women in clinical research and reach out to us. But there are so many opportunities. And I tell people, don't be afraid to create an opportunity for yourself. You don't have to wait for a company to hire you. And I didn't wait for a company to hire me before I got that clinical research experience. So if you have a passion for clinical research, don't let anyone tell you, oh, you have to wait till you get a degree, or oh, you have to have this certain type of degree to get into the clinical research industry, because that's not true. You can
Uh-huh.
start anytime. You can start networking. You can be any age to start networking if you're interested. You can always inquire about opportunities in the clinical research industry, and having someone as a mentor can help you and guide you. So I just helped a high school student. I went to a career fair earlier this year, and a high school student told me that she was interested in being a nurse, but she was looking for an internship. So I introduced her to a clinical trial site similar to how I got my start, and they hired her. And now she's starting her internship in high school. So she's ahead of the game versus me starting my internship in my 30s. So I was just very happy to help her start her clinical research journey. And it's about how passionate you are about it. So I
Mhm.
always tell people, don't let anyone stop you or get in your way of your dreams and your goals.
Yeah, that's wonderful. Kudos to that high school student who sought some advice from you, and look at her now. Yeah, that's great. Hey, look, and some of the information that you've put out there into the world, you've mentioned Black men in clinical research and minorities in clinical research. Are you in partnership with these organizations, and does that work?
So these companies are all part of my babies. These are all
Yeah.
these are all my babies. And so we are just trying to, once I created Black Women in Clinical Research, the men that were married to the Black women said, well, what about us? And then after I created Black men in clinical research, a lot of minorities reached out to me and said, well, what about us? So we just want
Yeah.
everyone to feel like they have a safe space in this industry, and
Mhm.
to be able to have a connection with people, like, because that's what it's really about, like having that connection with people who look like you, that can help motivate you in the clinical research industry, and whatever way we can do to help increase the numbers with the workforce, with the patient
Mhm.
population, because people feel more comfortable with people who look like them. And
Mhm.
so just letting people know that these careers exist, because clinical research is a hidden career. It's not
Yeah.
talked about a lot in colleges and universities. There are not a ton of clinical research programs. Clinical research is not a part of the curriculum for a lot of STEM programs as well. So people are finding out about clinical research later on in life versus early on.
Yeah. One thing that you educated me about today, because before you, if someone had mentioned clinical research, I would think about MDs, PhDs, PharmDs. I wouldn't think that, out of high school or out of college with any degree, there could be an opportunity. I wouldn't have known that. But now, thanks to you, I do know that. So my schema, Danielle, grew today.
My
Okay.
pleasure.
Yeah. So look, I know that that you also that is your organization, Black Women in Clinical Research, have a podcast. So, firstly, why did you all start a podcast? That's my first question. Why a podcast?
So we have our monthly career events, and we need to get our, that's a great reminder. We need to get our podcast back. We need to relaunch it again.
Mhm.
But what we currently do, we have our monthly career events where we talk about the different careers in the clinical research industry. So I think that's so important, because a lot of people in this industry only realize that they're interested in being a CRA without thinking about the other opportunities that are available, because there's so many different roles in the clinical research industry. So we want to just shed some light on these different
Mhm.
opportunities that are available. So that's why we have our monthly career events. We've been doing this probably since 2020. And we still haven't hit all of the clinical research careers.
Mhm. That's great. That's great. All right. So, look here, I'm going to give you a crystal ball, Danielle. It's all mysterious. I'm giving you a crystal ball. I want you to look 10 years into the future for Black women in clinical research. What would you like to see?
I would like to see us collaborating with more companies, and companies that aren't necessarily clinical research related companies. I think why clinical research is so hidden is because we haven't tapped into other industries and let them know about the importance of clinical research, and making sure that we bridge that gap between clinical research and healthcare, because a lot of people
Mhm.
don't feel like clinical research is a part of healthcare, but it is. It's a huge part that is not really talked about. So I would love to see more involvement and more people knowing about clinical research, and for this to be, I would say, programs at colleges and universities, and whether I can help with those programs, I would love to do that, and just to introduce the next generation to these careers in clinical research. So whether it is some type of education program, I would love to see that in more high schools, middle schools, colleges, and universities, and for BWICR to play a part.
Uh-huh. That's great. I love it. So, Danielle, is there anything else in your heart that we haven't talked about that you wish that you want to share today?
Uh, Yeah, really. I feel like we touched on a lot of different things, but I would just tell people to follow their heart and follow your passion. And, regardless if it's clinical research, maybe it sparked an idea about some of your interests that you have, but it's never too late to start your career. It's never too late to change your career as well. So I would just say to, not get discouraged. And, because I could have got could have been discouraged lots of times when I started in the clinical research industry, when people wouldn't hire me. And, I was trying to get into this industry. So I want people to think and to know to not let anything stop them.
Yeah.
And so besides that, I think that's really it. I can't think of anything that we haven't discussed, but I just want to encourage and motivate people.
That's nice, Danielle. Well, you're doing exactly the kinds of things that the Possibility Action Network, look for in people. You're clearly bettering people's lives, and you're clearly a force for good in the world. So, thank you so much for taking the time to talk to me today for this show.
Thank you. Thank you for having me.
You've been listening to the Possibility Action Network podcast. Our guest today has been Danielle Mitchell, the founder and CEO of Black Women in Clinical Research. I'm your host, Stephen Middleton. Until next time, good day.
You are not alone, just keep on, keep on, keep on going. Just press on, press on, press on.